I was a civilian volunteer at the Six Flags Magic Mountain vaccine site. My job was to make sure people had everything they needed before going to the next step. That way, nurses wouldn't have to wait for people to go through their stuff. It was late in the afternoon when a woman pulled up in her car. An elderly man sat in the passenger seat. The woman told me she was here to get a shot for her elderly father. Then she hesitated. Her mom wasn't going to be able to make her second shot appointment that day. Could she take her spot instead? The woman pleaded with me. She was an essential worker. I advised her to talk to the nurse, but I said that it wasn't likely. Deflated, she drove on. But the woman stayed in my mind. A couple hours later, I was standing in line with other mostly white, mostly privileged volunteers to get my first shot of the Pfizer COVID vaccine. In the days immediately following my vaccination, I was relieved to be vaccinated, but I also felt ashamed. The reward had made me feel like I'd found a way to leapfrog over people. I'd been vaccinated, but I'd done so with fake altruism. Some other well-off people I knew confided in me that they'd also been vaccinated, but they were keeping it quiet for the same reasons that I was, feeling guilty. So guilty that I started looking into a way to try to feel better about the whole situation. One of the first things I learned was that medical experts were not surprised at all at what they were seeing.
What's very interesting about Americans is that they have this myth that everybody in healthcare is treated equally when it comes to life and death. And this keeps showing us that they don't. Money matters, celebrity matters, connections matter, whether you have a car matters, whether you know somebody matters, whether you get on the internet matters. So deep divisions in our society that we don't like to acknowledge or reveal.
Let's be honest, privilege definitely helped me get that first dose, and I'm not alone. The vaccine rollout has exposed this really deep inequality in America. White people, like me, are getting vaccinated at rates way higher than people of color. Vaccine eligibility is still restricted here in the US, but when I looked into it, I found reports that people who don't actually qualify for the vaccine yet, based on their age or their medical conditions or their occupation, are still getting shots. They're doing this a few ways. They could be traveling to places that have less restrictive vaccine requirements. They could be jumping at chances to get extra shots when they hear about it. Or, like me, they could be volunteering. That's because the people who have the connections and the resources to get vaccinated early are probably also tech literate. Or they might have the means and flexibility to take work off at a moment's notice. Or both. Here's the thing. There is conflicting information out there. People who receive extra doses are told, wait your turn, but if you're offered a vaccine, take one. At the same time, articles about line cutting or vaccine tourism make people really angry. That's because they show how the privileged and the wealthy are flexing their power, potentially at the literal mortal expense of people who don't have that. This inequality is real and terrible, and it exposes a broken public healthcare system. But because we're in an emergency, experts take a bird's eye view of mass vaccination campaigns, because we have to.
If we were sorting out vaccine opportunities at a fine-grained level, you would probably not be selected. But we're not, and we shouldn't. You can't. The idea is just get people in there and jab them like crazy and try to get as many Americans as fast as we can. It's the one ray of hope. It's our best shot.
That doesn't mean people like me should ignore our ethical discomfort. One major issue with line cutting is that it reduces public faith in the mass vaccination campaign as a whole. And that's a huge problem because as many people as possible need to get the shot.
Most of what we're talking about is marginal, but what happens on the margins directly impacts willingness to support what's happening in the mainstream.
This is where people like me, experiencing vaccine guilt, can and should do something to help restore public trust. Sharing your experience, rather than hiding in shame while benefiting from your privilege, could be a start. It will probably open you up to criticism, as it will me, but an outpouring of people talking about how they've benefited from privilege could pressure public figures to help create a plan for how to best distribute leftovers and surplus. It's rare when the people who benefit from an unequal system are actually forced to reckon with it. In a few months, social media and public shamings will abate, but I don't want to forget how it felt to turn away that woman. I also want to contribute to an equitable healthcare system. How do I and we turn shame into change? While I realized that I was privileged and in some ways jumped the line, my own guilt prompted me to learn about the ethics of vaccination. Along with that came the realization that I could more safely spend time with my parents and my grandparents and people close to me who have underlying health conditions. The vaccine is a gift, and I'm so grateful. But right now, I'm going to spend my time trying to advocate for the people who didn't have the privilege that I did. While I was researching, I learned a few other things.
So we know that the vaccine rollout has been disproportionate. We know that in communities of colors, there might be less vaccine sites, and more than that, those sites might actually be being used by people from higher income neighborhoods that are coming into Black communities or lower income communities seeking access to the vaccine.
I also learned that I personally can use my privilege to advocate for vaccine equality. I can help others by lobbying elected officials. We should be pressuring them to reduce overcrowding through affordable housing, improving public health care, and supporting essential workers. I can work to alleviate the factors that led to the disproportionate effect that COVID has had on people of color. I can do this by advocating for the release of demographic data, hazard pay, and paid leave for essential workers, and testing and triage centers in Black and brown neighborhoods. And I can take comfort in the fact that the more people vaccinated, the better. We all need to work on getting shots into arms, period. And we can do that by educating ourselves and working with vaccine equity experts to make sure that the most vulnerable people are still getting their shot to get a shot.